So tocolytics are drugs which are used to reduce the uterine contractions. They're mainly used in certain circumstances, like you want to shift the patient to a better tertiary care center. So during transportation, you can give them a tocolytic, or if there is preterm labor, you can give them tocolytic. You give them magnesium sulfate, or you give them steroids. You wait for 24 to 48 hours after the first dose. So during that time, tocolytics can be given, and then they can be taken up for labor. So what are the different drugs used? We have calcium channel blockers, which includes nifedipine, nicardipine, verapamil. The mechanism of action is that it is acting on the calcium channel and blocking influx of calcium, which is responsible for contraction of the uterus. So hence it is helping in preventing labor. So it is given by oral. It's given by oral route. Metabolized in liver, excreted in urine. Side effects are headache, flushing, vasodilation, hypotension, nausea, uh, and vomiting. Now next drug is magnesium sulfate. So magnesium sulfate is basically, it has two modes of actions now. One thing is that it is acting on NMDA, inhibiting that and reducing vasospasm. So it's causing vasodilation. That is one of the actions. The other action that it has, it is causing competitive inhibition to calcium influx. So it is going and binding and preventing calcium influx, which is again leading to which is again preventing uterine contractions. Now the thing is that a very high dose is required for making. So its tocolytic effect is very poor. So side effects are respiratory distress, respiratory failure, cardiac arrhythmias, loss of knee reflex, perspiration, headache, muscle wasting. In neonates, it can cause depression, respiratory depression, lethargy, hypotonia. It's contraindicated in myasthenia gravis and impaired renal function. Next, we have cyclooxygenase inhibitors like indomethacin, sulindac. So these drugs are basically acting on the prostaglandins. We know prostaglandins are responsible for influx of calcium and again contractions. So they act by inhibiting production of prostaglandins and hence cause help in producing tocolysis. So these are usually given by oral or IV route. Side effects are heartburn, asthma, GI bleeding, peptic ulcer disease, renal injury, then platelet dysfunction. Then in neonate it causes constriction of patent ductus arteriosus, oligohydramnios, and neonatal pulmonary hypotension. Then we have beta mimetics like terbutaline, ritodrine, isoxapurin. So they act on the beta receptor, and beta receptor's function is smooth muscle relaxation. So again same thing, calcium reduces calcium influx, that is another thing. So basically it acts on the beta receptors and then it is leading to reduction in calcium influx. So this is given by IV infusion or subcutaneous route. Side effects are headache, flushing, arrhythmia, palpitation, tachycardia, pulmonary edema, hyperinsulinemia, hypokalemia, death. In fetus, intrauterine fetal death, tachycardia, heart failure, hypoglycemia, intraventricular hemorrhage. So it is contraindicated in maternal diabetes and heart diseases. Then oxytocin antagonist, atosibon, so it's acting on the oxytocin receptor and preventing binding of oxytocin to it. It is given by IV infusion route, causes nausea, vomiting and chest pain. Chest pain is a rare side effect. The nitric oxide, which is a smooth muscle relaxant, it is given via patches. It can cause cervical ripening, headache and hypotension.